Good afternoon, and thank you so much for joining us for today's episode of Thursdays with AARP Wisconsin. I am Amber Miller, your host, and also the Associate State Director of Community Outreach for AARP Wisconsin. Before we get to our guest, of course, I'd just like to do a couple announcements. Please make sure to check out the AARP Wisconsin website for information on upcoming events, information about vaccine, anything that you could think of. Please always know that our website is updated on a regular basis. Please also remember the AARP Friendly Voice Initiative. Once again, this was launched last year, and it's where you could put a request in to talk to one of our trained AARP volunteers just to hear a friendly voice on the end of the phone. You could put a request in for yourself or for your loved one. There is no cost. You do not need to be an AARP member, and you could be any age. You can look at the website below, or you could call the phone number below, and both of those will give you additional information on how you can receive this service. Please also remember, besides the AARP website for information, there is a separate AARP Wisconsin vaccine website. This will give you up-to-date information on the status of how the vaccine rollout is going, other additional information on where you can sign up or register if you have not done so already. Please make sure, if you already have visited our website, please also pass along this information to a loved one. So our show today, and of course it's April 1st already, it's hard to believe, with the first full week in April being Public Health Awareness Week, we thought it would be really good to highlight road safety as a matter of public health. So we actually have two guests with us today. Our first guest is Jana, who is the Senior Strategic Policy Advisor with AARP Public Policy Institute's Livable Communities team. It's a long title, but she's really important, and we appreciate all she does. And also, please remember during the show that you can post your comment or questions below, and we will be taking them during the show. So, Jana, I'd love to introduce you to the show. So thank you so much for joining us today.
Thanks for having me.
Absolutely. So for our viewers today, once again, we're going to be talking about some different aspects when it comes to public health and Livable's community. So Jana, can you talk a little bit about what are complete streets?
Sure. So complete streets are those that are planned, designed, built, and maintained for accommodating safely and conveniently the needs of all road users, regardless of age and ability. And really what that means is that we need to move beyond kind of our typical practice of where we're designing our roads for people who drive to really think about the needs of other road users as well. So how do we safely accommodate people who may choose to get around by public transportation, or who wish to walk and bike as a form of transportation, or even recreation? So some of the elements of complete streets may be sidewalks, well-marked crosswalks, bike lanes. But complete streets is not about a single design, because the design of each individual street needs to be done within the context of that street. So the concept of complete streets is really about changing how we go about investing in our transportation system. And it's about that process of planners and engineers working with the community to identify who are the users, who do we want to welcome to that street network, and then designing accordingly to meet those needs. And also, as we've seen during COVID, the design of our roads, especially our neighborhood streets, in ways that really allow us to safely walk and bike has been so important, given that it's one of the few opportunities to be able to maintain our social distance and yet still be engaged with others in our community through this active form of exercise.
And Jana, I do like, especially for our viewers who have never heard of the term complete streets, I appreciate the fact of changing the lens a little bit, that it's not all about the drivers, that it's about people who maybe ride a bike or walk. And I was telling you ladies, I'm house sitting this week, that's why I have a different background, in a suburban part of Milwaukee that has like no sidewalks. And I find that fascinating to me, of like, well, how are people walking around without getting hit, and just like changing the way that we think about complete streets. And I really appreciate what you said. If you could talk with Jana a little bit too, what is the relationship between complete streets and public health?
So I think you started to hit upon it. The biggest, most probably direct connection to complete streets and public health is in road design and safety. We actually are seeing a staggering increase in pedestrian fatalities in the United States, up 45% between 2010 and 2019, with the highest numbers killed in the last 2 years of data. And that, even though we're driving less during COVID, we're actually seeing fatality rates rise, in part because people with less traffic, they're driving faster, and speed kills. We're killing on average 14 individuals a day on our nation's roadways. So, you know, in almost every state, including Wisconsin, has become more dangerous, although Wisconsin does rank better than other states when looking at kind of the national average. So the other connections to public health are perhaps not quite as readily recognized, but I did mention of how important street design is to encourage us to walk more and to bike more. So if you feel safe going out of your home because you have a sidewalk to do that kind of activity, that's really important. There's also the importance of drawing people out to the street for social interaction. So my mother's hometown in West Union, Iowa, for instance, they had to do a major infrastructure project of their downtown Main Street because all of the utilities underground needed to be replaced. But they took that opportunity to really remake the street above ground as well. And so they built in not only widening the sidewalks and doing some what are called curb bulb outs in order to reduce the walking distance, the crossing distance for the pedestrian, but they also built a little kind of amphitheater on the courthouse square where they have outdoor concerts, and it's really helped to kind of regenerate some of that social interaction, particularly in the warmer months. There's also the connection to public health through improved air and water quality. So as we walk and bike more and put less carbon and other type of pollutants into the air, we all benefit. And that's something Harvard researchers have actually found during COVID. Those cities that have the highest levels of air pollution are seeing higher levels of COVID deaths as well. And this is something we've seen even in small cities in the United States prior to COVID, that higher levels of air pollution, there are much more serious complications from asthma. And then finally, there's that connection to local economic development. So as you welcome people to slow down and kind of enjoy a street, those individuals are much more likely to go into a store in order to, you know, support the local economy. So many, many benefits.
Yeah, and I was actually thinking, and I know this might go a little bit more with our next guest, is January of last year, so right before COVID, I actually did a walk audit with one of our local communities, and we did it in the winter because they wanted to see how it was for somebody, you know, walking on the streets and biking, and how it was with snow removal. And it was extremely eye-opening to see how it wasn't the easiest for one of our elderly committee members who had a walker, and how people are designing stuff with maybe not hearing the feedback from the community. So I feel like you're really hitting it on the head, Jana, about how important it is. Who has complete streets?
So there are over 1,600 complete streets policies that have been adopted in the United States, including those adopted by 35 states, the Commonwealth of Puerto Rico, and the District of Columbia.
Wow.
And here in Wisconsin, there are 13 local jurisdictions with complete streets policies. The state used to have a state level complete streets policy, but unfortunately, Governor Walker rescinded that during a budget process. And that's actually one of the common misperceptions of Complete Streets policies. And really with this, this is about not asking for a new pot of funding in order to fund sidewalks, et cetera. It's about spending our money differently. And really that process of thinking about whose needs do we need to be serving. Now, I want to throw out a plug for an AARP resource called our AARP Livability Index. If you haven't checked it out, you'll want to do that. And we track every community and neighborhood across the United States against 60 indicators of livability, safe streets being one of those. And so we're tracking all of those policies. And we're currently updating that. So Milwaukee and Stevens Point have new Complete Streets policies. And so those two jurisdictions will be getting credit in the next iteration of our index. I also just want to put out a couple other plugs of AARP resources. One, we have a streets and sidewalk survey, I think, Amber, that you mentioned, that's available to communities to use. We're also working to build out some resources on how to activate public spaces during winter months. And I mentioned Complete Streets. It's not just about the design, but it's also about maintenance, snow removal being one of those. And how do we make sure that we're maintaining safe passage during the winter months, especially in states like Wisconsin?
And for our viewers, we will put the website of the Livability Index into the notes of this. I was on there because I presented on livable communities maybe a couple weeks ago, and it's such a fascinating tool to use because I don't think a lot of people either know about it or haven't used it, of how safe is your city or community or state. So we definitely encourage you to visit that website. Jana, what's on the horizon at the federal policy level right now?
Well, I think many people may have heard that yesterday the Biden administration released kind of the sketches of an infrastructure bill, which would call for a pretty significant increase in infrastructure funding, not only in transportation, but across other areas of infrastructure. There's not a lot of details in there at this point, and so I don't know quite how Complete Streets might show up. But another bill that was introduced in February is called the Complete Streets Act, and that would actually set aside a portion of federal highway funding that goes to states in order to create a grant fund that would fund these types of Complete Streets projects. And then eligible localities, those localities that have adopted policies that meet kind of basic threshold levels of what constitutes a good Complete Streets policy, would have access to some additional funding for these types of projects. So again, it's a great reason, the ability to tap into federal funding for why you might want to get these policies adopted at the local level.
And Jana, what website could people go to for more information on the walk audit, the livability index, all that goodness that you're talking about?
Probably the most streamlined URL would be aarp.org/livable.
Great, and we just put that up on our screen. Even though I work for AARP, I get lost in a good way on that website. There is so much good information. There's information on how to do pop-up events, how to, get stuff done in your neighborhood. It's just a really great website, so I definitely encourage people to start there. Jana, I want to thank you so much. And we're going to bring on our next guest, but we just want you to also, we're going to put you in our green room because we'd love for you to come back at the end of the show. So thank you again, Jana. We really appreciate it. Our next guest is Miss Marianne Jackson. She's the interim director of the Gibson Center for Senior Services in New Hampshire, and also very involved in the Age Friendly Network, especially when it comes to rural initiatives. Hello, Marianne. Welcome to the show.
Hi, thanks for having me.
Absolutely. So what was the reaction of your municipalities, because you're in New Hampshire, so you're not in Wisconsin, when you asked them to commit to being age friendly, and how did you sell it?
Well, when we started, which was in 2017, we had the information about how the AARP's, World Health Organization's livable communities structure worked. And we were so impressed, we, meaning the Gibson Senior Center as a nonpartisan, non-political group that really saw the benefits of looking at how we make improvements across all the domains of transportation, housing, health, outdoor spaces, and what we called community connections.
Mhm.
And when we studied it and saw how it had been implemented in other areas, we could see that it was municipal driven, but it didn't cost the municipalities anything to commit to saying, we believe that the improvements that we're going to make should be seen through the eyes of all generations.
Mhm.
And seniors being the group that we advocate for, but what we really were able to say to them is what's good for seniors is good for everybody.
Mhm.
So if we are making our region, and I want to emphasize, we are a regional, we're a little bit different because we're
Mhm.
not one town, we're not one city or one state, but we are a resort area of 11 towns that actually
Okay.
even spans 2 states.
Wow.
So we work together anyway as a region with a regional high school and a regional newspaper and a regional chamber of commerce. And so and housing, I mean, all these different agencies already were covering the citizenry. So we were able to say to the municipalities, we're
Okay.
going to do the work and we're going to help you look really good. And we want your citizens to be taken care of and to be aware of all the benefits that come to them through you. So it was an absolutely easy sell, and we kept saying, this is not a budget item. We're
Mhm.
not going to ask you for money. And I think Jana did a really good job of really indicating it's how you think differently, not putting necessarily more money at something, but how do you design and think through the solutions with your seniors and therefore really everybody in mind. And I think if we can see one of the slides, you'll see
Mhm.
how that works out.
Yep, absolutely. So we'll bring
That's
up
us.
Dan.
That's our
Beautiful.
logo. And so I wanted to just reemphasize that it comes through these different lenses of transportation, housing, and I'm a master's in public health. So the health
Mhm.
part of it was particularly interesting to me is how does this pull our resources together to look at health, which is obviously connected to outdoor spaces. And as we learned through COVID, community connections is an enormous public health issue. So it really did tie together. And you can see in this next slide that the things that we took on,
Mhm.
because we had 6 months, we put together an action plan and there were 17 major goals. And I'm just going to highlight the ones related to outdoor spaces and health. So somewhat riffing off of what Jana said, outdoor spaces, meaning walkability,
Mhm.
is so critically important. And one of the things that we saw was that people didn't even really know where the most walkable trails were. So we walked them and
Mhm.
then had up on the website, here they are, here's how the parking for them, here's whether it's wheelchair accessible or not, and really challenged people
Mhm.
through it's not on, oh well, yeah, on the bottom of the slide, the 100 days of wellness. We challenged people to go walk those trails and get the health benefits. So then by the time COVID hit, people knew them, they were ready,
Nice.
and they went outside and they knew that this was the safe, um, accessible place for them.
And I definitely think, Marianne, during COVID, I think it probably woke up a lot of communities on how can we make, walkability better, green space, and do people know? And especially when we're so limited with what we can do. I can only speak in Wisconsin. the mask mandate may have changed as of yesterday. They said we don't need to do masks. We're still going to do it. But, there's still a lot of things that aren't open or that people don't want to go to. So I love that. I love that the whole initiative was such an easy sell for your community, because I would hope to think all communities it would be an easy sell.
Well,
Fingers crossed.
we're an aged population, and we're much higher than the average in the country. But what we found fascinating is that it was the mothers with toddlers in strollers who were accessing the website as much as the seniors. Wow. So then COVID hits, and the mothers want to get outside with their kids. So that was one of the immediate benefits, and we found those trails in every town. So now in COVID, one of the things that we've been really excited about is that we already had promoted our 211 site, so people were familiar with it, of how to access it for help. The Good Morning Police program was so important because there were seniors isolated at home who were at risk of us not identifying that they were in trouble. And so we had this robust police wellness check program in place. And one of the ones we're so excited about is that the people donating laptops and partnering with our librarians to train seniors who otherwise didn't know how to get on Zoom, how to do email even. And then, of course, the importance of telehealth. So the last thing that we're most proud of is the Gibson Senior Center and the rest of the county, that C3PH is our county public health group. We have been sponsoring and getting the word out and getting the volunteers and the transportation to do literally hundreds of seniors, Meals on Wheels recipients, and drivers, RSVP drivers, and more vaccinated.
And Marianne, do you feel that the age-friendly fared, how did they fare during COVID compared to your original goals?
It was very difficult because we're a very social and, connected, loved meeting together. I had people say, I love coming to your meetings. So we've had to do a lot to try to keep the momentum going and the conversations. But what is exciting is that we had enough success that the groups are eager to get together again and say, now what else can we do? Where are we going? Because we're seeing the light at the end of the tunnel.
Absolutely. And do we have one more slide, I believe?
I don't think so. I think we're there.
Oh, that was okay. So Marianne, first of all, I'm jealous because your community sounds amazing and it sounds like you're doing just really great things. Do you feel like your model could it come to Wisconsin? Do you think that's something that we could take your model, do here in Wisconsin, or do you think that would, could we replicate it? Could we steal your model? Do you think we could do that here in Wisconsin?
Well, first of all, everything that we've done is online and available through the gibsoncenter.org website. It's posted. Anybody can steal anything. It's also on the AARP's Livable and one of the action plans. I'm available to consult with anybody, but it's absolutely replicable because the AARP model is well designed. And we found that through the rural community network that we're now members of, and we have access to people like Darren and you, that we have more in common with our rural neighbors across the country than we do necessarily with some of the cities who drive the conversation in New Hampshire. So absolutely. And I think in small towns, because small towns, people know each other, they know where the resources, who are the movers and shakers, what do we need to do to get it done? And we show up, whether it's through churches, visiting nurses, libraries, and we all talked with each other.
Great.
That's all it takes.
And you know what? I want to say it really should be that easy. It should be that easy, what you just said, Marianne. And I hope that our viewers now, it's April 1st, spring. I can only speak for Wisconsin. It's still a little cold here today, but let's start really looking at our community differently and, make sure it's a place that we feel safe in, that we want to age in, that, we can work together in, and how great that would be when you look at your community even 5 years from now.
Our vision is that where we live in the Mount Washington Valley is where that you wouldn't want to live anywhere else.
Very nice.
There you go.
I love it. Okay.
So let's do that.
Challenge. That's a
Let's
challenge for. So thank you so much, Marianne. We're going to bring Jana back because it looks like we have a question and a comment. And I do just want to briefly say from what Marianne said, there's over 500 age-friendly livable community cities or communities within the U.S. Marianne referenced her action plan. So each community has an action plan, and it is available for anybody to look at. Sometimes I love to just pick different states out of Wisconsin and look how different and similar a lot of the action plans are. So if you're looking maybe for a good read, we definitely encourage you to visit the AARP Livable Community website. Producer Courtney, would you be so kind to bring up Jim's comment? So Jim said, what is the first step a resident should take to get his or her community leaders to prioritize complete streets in their community? And I can start with Jana on this, and then Marianne, if there's anything you want to add.
So I would recommend starting with trying to get a policy adopted often through resolution by the city council or board of supervisors, the equivalent of what you may have in Wisconsin. But to get their attention and to get their understanding, I think AARP has a number of great resources, just kind of very short descriptions of what we're talking about that are very visual. There's also the National Complete Streets Coalition that has some great resources. And then as a second step, I would really strongly encourage doing a community walk audit and invite those elected officials, invite the press, get a network of community members who have different abilities in navigating their transportation network. So I think it's really important to bring people with disabilities to that table, to make sure you involve some older adults as well as children. And how do people experience those streets differently? And a lot of times by going through that walk audit together, people have those aha moments that really can help show the need to get a policy in place. And then there's a whole series of steps at once you have a policy of really building that into your design manuals, etc., planning processes.
Great, thank you, Jana. Marianne, anything to add to that question?
I just found that the visuals that AARP have are so empowering, because you go, oh, they did it. Oh, we can do that. And that when you see it, it opens people's eyes. Other people have done what you want to do.
Absolutely. And producer Courtney will bring up, it looks like Reed has a comment. Universal access increases better life for all, makes quality of life better. Actually knowing access livability rather than guessing or assuming is peace of mind. Ladies, what are your thoughts on that? Marianne?
Well, I think the concept of livability is very useful, because what you're talking about is vitality and expanding the sense of safety, of engagement, of empowerment. And that's we can get into a whole discussion about age bias, which we're not, but I just think you're maximizing it.
Absolutely. And Jana, final thoughts?
Well, I wholeheartedly agree with that statement. I often think of complete streets as really being universally designed streets. It's making them work for everyone.
Great. Well, Marianne and Jana, I want to thank you guys so much for being on our show today. I feel like the information really will start opening people's eyes to their community, to where they live, and maybe little things that they can do to really empower their communities. So I want to thank you both for joining us today.
Thanks for having me.
Absolutely. Pleasure. Thank you. Please also, there are some upcoming events that I would like to share with you that you could check out. We'll be bringing that up in just a moment. All right. So April 6th, we have COVID vaccine misinformation through our AARP National Office. We also, on April 7th, will be partnering with the Milwaukee Historical Society on beer tourism. It's open to all. If you're looking to work for yourself at 50 plus, our partners over at the Fox Valley Technical College will be hosting that. And then at 1 p.m. on the 13th, Livable Communities 101, you could check below and register or dial the 1877 number. Please also remember our small dollar big impact grant is due April 21st. These are small grants that you can use to empower your community. You know, exactly what Jana and Marianne were talking about. These grants are up to $1,000, and we launched this program last year. It's been super successful. So you can find more information at the website below. Also remember the AARP Community Challenge Grant. The applications are due April 14th. You can check out the website below that's in red to receive more information. And lastly, please join me next Thursday as we're going to be talking. She's always my favorite guest, my coworker Helen, when she's going to be talking about sharing your opinion with the Joint Finance Committee. This is obviously for the state of Wisconsin, and that's April 8th at noon Central Time, back here on our Facebook.com or YouTube page. And once again, I want to thank you so much for our guests, and I want to thank you so much for joining in today. We look forward to seeing you next week, and until then, be safe.